Hi, my name is Avani Karthik, and today I'll be presenting about SHIELD, a novel solution for outpacing antimicrobial resistance. But first, a little bit about me. My name is Avani Karthik, and I'm a rising senior at Lambert High School in Cumming, Georgia. I'm kind of interested in the intersection of policy and synthetic biology and healthcare, and how that can help bridge the gap in medical care and equipment in the US and globally. My experience comes from iGEM, a synthetic biology-based global competition, and my work at the Baumol Lab at Georgia Tech, where I help create low-cost lab equipment. The World Health Organization has declared antimicrobial resistance, or AMR, as the biggest global public health threat of the 21st century. In 2021 alone, AMR directly caused 1.14 million deaths and countless more indirectly. So, what actually is AMR? AMR occurs when microbes evolve to resist antibiotics, rendering traditional treatments ineffective. AMR develops through the natural selection of resistant strains and intensifies through the transfer of resistant bacteria. Antibiotics have become one of the most transformative medical discoveries of the 20th century. They're responsible for many recent medical breakthroughs, including safe surgical procedures, effective cancer therapies, and organ transplants. However, the rapid emergence of AMR is rendering even the most advanced antibiotics ineffective. As AMR continues to spread, we risk losing the ability to treat once manageable infections, potentially returning humanity to an era where minor infections are significant health threats. This revolutionary technology, which previously extended the average human lifespan by 23 years, now faces the stark reality of reversing a decade of medical progress. To combat the AMR crisis, as part of Lambert iGEM, I worked to develop SHIELD, a versatile toolbox enabling the efficient creation of novel antimicrobials to circumvent resistance. With SHIELD, researchers can develop multiple antimicrobials for one pathogen, targeting several genes at once. This is made possible by CRISPR interference, a technology that silences target genes, effectively killing the pathogen. CRISPR-I is known for higher on-target rates than CRISPR, and it blocks instead of cutting like CRISPR does. We selected the INHA gene from Mycobacterium tuberculosis, or MTB, as a proof of concept due to its role in the pathogenicity of MTB and the urgent global health crisis posed by the widespread emergence of drug-resistant MTB strains. To determine whether CRISPR-I would be comparable to CRISPR for silencing critical genes, we developed ODE models simulating Cas9 and dCas9's capabilities. Both systems demonstrated a similar level of gene repression, validating CRISPR-I as a safer alternative to CRISPR. We then tested sgRNA70 with the INHA target gene, achieving a sufficient decrease in expression. Our model-informed wet lab results demonstrate effective silencing of a critical gene, showing the promise of SHIELD and rapid therapeutics development. To quantify the efficacy of our CRISPR-I reactions, we used toehold biosensors. Toehold switches are riboregulators that consist of a specific RNA switch site and a ribosomal binding site, or an RBS. These switches have complementary triggers that activate the quantification system when present. Toehold switches utilize a special RNA sequence and a hairpin loop, preventing the translation of the downstream reporter gene, which in our case is green fluorescent protein, or GFP. However, when the trigger binds to the switch sequence, the toehold structure elongates. This exposes the RBS, allowing for the translation of the reporter gene. Basically, when the target gene is present, the switch is activated. However, when the gene is successfully downregulated, the switch remains inactive, resulting in negligible GFP output. As you can see here, we also gained successful results with one of our toeholds. Our CRISPR-I toehold system allows for more rapid development of antimicrobials. NewPack, the design software used by researchers and our team for toeholds, has a high error rate, resulting in inaccurate predictions of switch behavior in vitro. Thus, our team created SWORD, a machine learning-based software tool using convolutional neural networks to model toeholds. Based on a dataset of 191,000 experimentally tested toeholds, SWORD achieved an R-squared 5 times that of NewPack. Beyond our goal of creating an alternative to traditional antibiotics, we simultaneously work to increase the accessibility of synthetic biology. After consulting several iGEM teams across the world, we recognized a common issue: time-consuming and tedious pipetting. Currently, liquid handlers range from $5,000 to $300,000, making them inaccessible to many labs. To save time and money, we created LabPilot, an affordable automated liquid handler. In 2023, we built Lab Pilot from scratch with the 3D printed frame and easily accessible parts, as you can see right here. However, following user feedback from the Baumla and Stye labs at Georgia Tech, we pivoted to an Ender 3 3D printer for the base, which gave us more durable and cost-effective foundation, bringing the total cost to only $200. Throughout our project, we consulted industry professionals, stakeholders, and experts to constantly refine our approach to combating AMR. We first spoke to Dr. Jesse Jacobs, who informed us about the gaps in public education and how that fuels AMR. This led us to focus on public awareness through community education. To maximize impact, we consulted Dr. Brittany Cantrell, the secondary science specialist of our district, who advised us to try vertical education to target every age group. Incorporating expert feedback, we published a children's book about AMR awareness, held national webinars focusing on AMR and synbio education, boot camps, shadowing opportunities at Tech, and more. AMR threatens the very foundations of our healthcare system, and SHIELD represents a significant step forward in the fight against it. We've combined CRISPR technology, toehold switches, machine learning, and liquid handling automation to create a versatile toolkit that effectively combats AMR. Please scan this QR code to see any of my references. And I'd like to have a special thank you to the 2024 iGEM team, as you can see here, and specifically Ms. Kate Scher, along with all these companies who helped us along the way, and a big thank you to the iGEM competition themselves. Thank you for listening, and please do go to our 2024 iGEM wiki to see more about our project. Here is my contact information. Please do let me know with any questions. Thank you.